Okay, so the assessment that we chose is the baseline tactile Semmes-Weinstein type monofilament. The baseline and tactile are all trademarks of Goldberg 2017, and the authors were Professor Sidney Weinstein and psychologist Dr. Josephine Semmes, or Semmes, however you pronounce it. And they worked together, and they developed this instrument, which was originally referred to as the Semmes-Weinstein pressure aesthesiometer. And it was a calibrated series of nylon monofilaments inspired by the von Frey horsehair instrument, which permitted the quantification and classification of sensory loss in brain-injured patients. They had used monofilaments to map cortical areas of the brain in monkeys. So in terms of the population that it was designed for, it can be used with anyone who is experiencing any kind of neuropathy or with a possible loss of sensation, clients who might be experiencing weakness, numbness, or pain in their feet or hands. And one study even found that it might be a valuable quantitative method for detecting moderate to severe carpal tunnel syndromes. And then the overall purpose of this assessment is that it's a screening tool for neuropathy that provides a non-invasive evaluation of cutaneous sensation level with objective and repeatable results.
This assessment can be used in clinics and requires a set of Semmes-Weinstein monofilaments that comes in a hard case, protective carrying case. So, each monofilament is marked with its size and force. As you can see here, there are 5. The client should be seated at a table across from the practitioner with their hand resting on a towel.
Rest patient's extremity on a stable, padded surface. Make sure patient cannot see the filament being applied during the test. Instruct the patient on the testing procedure and to indicate when stimulus is felt.
So we're going to be using these monofilaments. I'm going to be applying pressure right here, okay? And we're going to be using different widths for each one. And you're not going to be looking as I administer it.
You may use screening forms to record results. Note any areas of callus, abrasion, scarring, or other blemishes by drawing them on the screening form. While testing, proceed from distal to proximal and from small to large filaments. Determine where to test. Checks can be done over areas innervated by different nerves. For the hand, test the palmar surface of the index finger and thumb for median nerve function. Test the little finger and hypothenar eminence for ulnar nerve. Test the dorsum of the hand for radial nerve. For monofilaments 1.65 through 4.08, apply the monofilament in the same location up to 3 times to elicit a response. A single response indicates a positive response. While holding the handle, push the filament at a 90-degree angle against the skin until the filament bows. Hold in place for 1.5 seconds, then remove.
I felt that. I felt that. I can feel that. I feel that. Yes, I felt that. I felt that too.
For monofilaments 4.17 through 6.65, apply the stimulus once.
I felt that. I can feel that.
And that is the exam.
All right, so this is the chart that has all the norms with the different sizes of the monofilaments. So, for example, this top one says 1.65, and if they feel it, it is considered normal for the hand and dorsal foot thresholds. And you can see as the sizes get bigger, this is normal, just diminished light touch, and then it goes all the way to deep pressure sensation only. So these are all within the normal limits, and then if you cannot feel it, then that is an area for concern, and you would document that and go from there.
The time to administer this assessment varies depending on the client's level of sensation. If the client cannot feel the first monofilament, they will require the use of additional monofilaments that will gradually increase in diameter. The administration of this assessment is straightforward and fairly easy to get. The directions for this assessment is easy to read and comprehend. This assessment increases reliability and validity when the same practitioner administers the assessment. Therefore, you should try to practice intra-rater reliability. It's the best for this assessment. This assessment is a reliable sensory examination of the upper extremity. It also can be a valid, reliable sensory examination of the upper extremities in patients with chronic stroke. This assessment can also be used as a screening tool. The SWTM is a norm referenced assessment. Current literature suggests that the nerve conduction study is a gold standard for diagnosing diabetic neuropathy. Unfortunately, this assessment does not have any functional substitutions. Therefore, a filament kit is always required. A limitation for this assessment is that it needs to be purchased and may not be accessible.
This assessment can be used during evaluation and reevaluation, and it can be used as an effective outcome measure as it will track a client's progress from baseline to post-intervention. In terms of frames of references and models, we believe that the Semmes-Weinstein monofilament is based off of the biomechanical frame of reference.
This assessment addresses the following occupations: ADLs of bathing and eating, IADLs of meal preparation, work, job performance and maintenance, and leisure participation. Client factors that are addressed through this assessment include body functions, skin and related structures, and body structures, sensory functions, touch functions, pain, sensitivity to temperature and pressure. Performance skills that are addressed through this assessment include process skills of handling and touching, and motor skills of gripping, manipulating, coordinating, and lifting.
So for the two possible occupation-based outcomes, we mentioned if you cannot improve hand sensation to improve the safety when performing ADLs and IADLs, you would teach and educate the client on how to be safe when performing IADLs of cooking and meal prep, such as making sure that you wear proper gloves when opening the oven if things are hot, and boiling water. And then for another occupation, we said we would work on bathing, so the ADL bathing, if making sure you have using a thermometer to see if the water is too hot before entering the bath. So just educating the client and making sure that they're aware that because of their lack of sensation that they are more at risk for safety features, and so we have to use adaptive equipment to make sure that they are safe performing their ADLs and IADLs.